So even though you're using the CPAP the first 3 years on a regular basis, you still had issues?
Yes.
Okay. And then the last 5 years, things kind of went downhill?
Yes.
And then it was always an issue with your wife with the noise of the machine?
Correct.
And she was concerned with your breathing the whole time?
Right.
Whether you were breathing or not? Okay.
Right. And it was on a trip back east that I found that when I got back, I was more tired than I was before I went on the trip.
Went for vacation.
And we went to Washington, D.C.
That's a great place.
And it was just really horrible because I had no energy to go to the Smithsonian Institute or anywhere else. And it got to the point where when I went to my primary doctor, and he said, well, why don't you just search and see if you can find another kind of mask. At that time, my eye had just gotten to the point where it was just really bloodshot. And I went on the internet and I looked up sleep apnea. Then I saw your name. And I said, well, I talked to my wife. She says, well, what you're doing now is nothing.
No, it's not working. Let's give it see what information you can get.
And I read some of the testimonials there, and I saw where there was a device. Now, I was told that there was a device through my primary doctor, but they were selling them out of a dime store,
right,
as you might say.
Yeah.
And he said that I needed to go to somewhere where it could be made primarily.
So it'd be a custom fit.
Right, and then you were reading about the one that you made was custom fit.
Exactly.
And I went to another dentist, and he says, well, I don't make them, but there are dentists that do.
Right.
And so I tried to look up, and I found your name, and I came here and had the device made.
Okay.
And it really changed not just my life, but my wife's.
Which is all really important.
Yes. I don't have the leakage to worry about.
Right.
I don't have the problem with waking up with dry mouth like I was before.
And your wife gets a good night's sleep.
Yes, yes. My wife even took me to lunch because she told me that thanks for letting me sleep when I got the device.
Right.
Now that when I get up in the morning, I'm more energetic by using the device. And my wife, by the way, has had to check me in the middle of the night because everything was so quiet.
There's no noise. Everything's nice. There's no snoring, and there's no stoppage of breathing. So the biggest issues you really had with the CPAP was the result wasn't as good as it should have been. You had the eye issue.
Yes.
The dry mouth.
Yes.
You're still tired during the day. You were moody. You couldn't exercise. You really would. And when you take vacations, you're really worn out and tired, and you couldn't go do the things you'd like to do with your life.
Correct.
And if I remember correctly, you also mentioned that your doctor said that the oxygen levels in your blood from the different tests he gave you were lower than they should have been.
Yes.
Okay.
Yes.
So when we have a situation like that, there are dental oral appliances that will deal with the sleep apnea issue. Now, sleep apnea is a medical condition, and we're curing it and preventing it from many of the symptoms from occurring with an oral appliance. The one we like to use is this one right here. It has two pieces. It's an upper piece if it's on the upper teeth, and a lower piece if it's on the lower teeth. And the reason it's so nice is, number one, it allows you to open and close and move around. So it keeps your jaw a little healthier than it would if it was fixed in place or didn't have as much mobility. So, for example, there are a lot of people watch TV when before they go to sleep, or they read a book in bed. And many people fall asleep. Well, if you have an appliance that is not as mobile as this one, they don't want to put it in until right before they're ready to fall asleep. But when you're watching TV and reading a book, it just happens. With this, people put it in as soon as they get into bed, and they're ready. And if they nod off while they're reading or watching TV, it doesn't make any difference because the appliance is in their mouth and it's working, and it's effective and it's comfortable. That's number one. Number two, this appliance has these little blocks here that have a gauge in them that makes this appliance titratable, which means we can adjust it for as small as 1/10 of a millimeter at a time. which is fabulous, which makes it very, very comfortable and extremely, extremely adjustable. And since the biggest side effect, Charles, of dental oral appliances that cure sleep apnea, the biggest side effect is TMJ, muscle soreness. So in order to get the appliance to fit correctly to solve your sleep apnea issue and not have TMJ issues, this appliance is really fabulous for that, which is why we use it. What I'm going to do now is put impression material on this holder and put the block back in your mouth. So you have a registration of how your teeth meet at the position where you have the best airflow. And we can duplicate that position with the appliance so the airflow will be really, really good when you're sleeping. Okay, this open real gently, perfect. Okay, close to you, move your jaw forward. A little more, yes, perfect, stay just like that. Just like that, for about a minute and a half that will set, Charles, and we'll take it out and we'll have that registration of the exact position where your airflow is the best. We're going to take that out, there we go. And now we have your teeth registered on the top of the plate and on the bottom so that we know exactly where to put the models to make the appliance work correctly for you. Now that we have the two impressions taken, an upper and lower custom impression of Charles's teeth, along with the custom bite that will allow us to put the models together at the exact position that Charles had the maximum airflow. And so while he sleeps, he will be able to take in enough oxygen that he'll wake up in the morning, feel great, feel energized, rested, and go about his life healthy and comfortable.
Hi, my name is Charles Walker. I came in with a problem of sleep apnea and using a CPAP to see Dr. Gorman, and I left with answers and a solution, and I am very, very happy.